My name is Gary Gunner Jr. I'm 36 years old.
Oh, let me see the baby.
A year and a half, 2 years ago, after my daughter was born, I just wanted to get checked out. Nothing felt wrong. I just wanted to get checked out to make sure. I want to be around for her.
So we just wanted to check in on how things are going with the medications.
When we're talking about a subject like high blood pressure, it's a condition without potential symptoms until it's almost too late.
Once he told me my blood pressure was high, I guess I wasn't shocked or I wasn't surprised because it kind of runs in my family, but it's scary at the same time because I know what people go through with high blood pressure, and I just wanted to change something about it.
Well, the high blood pressure registry was created in 2010, so we started with about 60,000 patients. I think we now have 213,000 patients in the registry. Frankly, it's just spectacular that we have that level of involvement.
The work that we do with clinical practices has been very robust and has resulted in our having a very unique asset, which is a regional registry of blood pressure readings for those patients who are diagnosed as being hypertensive. That really gives us a picture of what we look like and how we are improving or not improving regionally.
So what we're able to do now is to provide each practice with a report that lets them look at how they compare with their peers. And I can guarantee you that no practice wants to do less well than somebody they believe is their peer.
Common Ground Health has been very instrumental in helping to kind of link practices to blood pressure data and other information. I get to go out and visit other places around town that are doing work that's slightly different than how I've learned or seen. And I get the opportunity to kind of learn about what things are working and not working.
One of the things we learned is we could focus our attention on those people, the people with blood pressures greater than 160 over 100, who we are increasingly worried about.
So looking at the numbers, we have definitely saved lives, decreased strokes and heart attacks throughout the time that we've been collecting this information and sharing it with the other practices. This is that kind of team effort.
If the team is working on that, and the receptionist, the medical assistant, the nurses are all in sync with helping the physician manage the patient's care, it creates a whole new environment and a way of successfully treating people. So now we can start to look at what's different about the practices that are doing better than the others who take care of the same kinds of people.
Give Daddy a big hug. Oh yeah, oh! After the diagnosis, I tried to take everything head on. So I started eating more vegetables. I started to work out probably at least 3 times a week for a minimum half hour. I grab a water, take a small pill, and I'm done for the rest of the day with that pill. I think my last visit to the doctor was probably my best rating, and I was happy about that. I mean, my weight, my weight is lower. It's just, everything is better. Introducing Madison Sky Gunner, yay! I want to make sure that I'm just here as long as I can. I want to be here forever for my daughter. So if it takes me going to the doctor, it takes me, taking 1 pill a day, exercising 3-4 times a week to get my health better, just make sure I'm around, that's what I'm gonna do.